patient behavior and treatments for relapsed refractory follicular lymphoma is very heterogeneous. So what we wanted to look at is sort of outcomes in our patients, especially with the introduction of several novel treatments in the last couple of years, to see if we'd see an improvement, more utilization, and hopefully improve patient outcomes. And so we looked at the CODA database just to try to extract as much as possible for patients with third line plus follicular lymphoma. We tried to exclude other complications such as other malignancies and diseases that may impact patient outcomes unrelated to their follicular lymphoma. And then sort of looked at it in multiple variants of age, time from progression from treatment. We also looked at site of treatment, rural, urban areas, and academic and private practice just to see patient outcomes. And we also looked at sort of what agents are being utilized in this patient population. So I think from this, what we saw was obviously there was an increase of use in some novel agents, but probably not as much as we would anticipate, especially in the community setting. So we still, saw quite a bit of just rituximab and chemoimmunotherapy utilization in this community setting, and less use of some novel regimens such as R-squared, PI3 kinase inhibitors. And so we also saw maybe some improvement in outcomes in patients treated at academic sites versus community sites. But this is just, again, some preliminary data retrospectively that sort of gives us a hint of what things are going and sort of how we can possibly make improvements in long-term outcomes, especially with the utilization of newer treatments such as CAR-T and bispecific antibodies. I think one key piece that we took out is that it confirms that our patients suffered quite a bit during the COVID era, as we saw, quite a bit of increase in mortality during this COVID era, more than likely related to infections from that virus.